Hello, excited to be with you again from Unified Oski. Your success is our delight. Yeah, I would just like to take us through understanding when you need to code medication in the implementation station. So, coding is just numerical values assigned to the reason why you choose not to give a medication. And we have that in the front page of the match chart. We can quickly have a look at that. It has a code of 1 to 10, and the reason for the code is stated beside the code. We have code 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for the 10, it's for other reason why you're not coding a medication. So any code that does not fall between the category of 1 to 9 will come under a code of 10. And for code of 1, 2, 3, 4, and 7, you are not likely to have that code. You are not likely to make use of such code during your implementation station in your ski. You're likely to just have it as a pre um, as part of your chart, the chart that is before the timing of your medication. So that's just the code. So as we go along, we get to understand when we need to use this code. You are to code medication due at your time. So if the medication is not due at your time, you can just escalate it verbally and move on. But definitely escalate verbally if it is not due at your time. But if it is due at your time, you need to code such medication. So if the medication is not due at your time, you don't need to code. Do you ensure you escalate it verbally so the error can be rectified, especially when you have allergic cases. Now, for community scenarios, sometimes candidates get confused when you come in across community scenario and you have the doctor's name, signature, you don't have the bleep number. For that, the prescription is still valid and complete and legible. For community scenario, you may likely not have a bleep number because it's a community scenario. Okay, now in your medication, when you read through your match chart, ensure the prescription are clear, valid, legible, containing all the necessary details, the patient full name, address, hospital number, the dates you are given that medication, the time, the route. You ensure it's the correct dose, the doctor's name, signature, bleep number for in-hospital scenario. And for community scenario, like I said, you may not have the bleep number, but that still render the prescription valid and legible. But if any of this information is missing, you can go for a code of 10 other reason and state the reason why. But if you have a specific reason why you feel this prescription is incomplete or incorrect, you can always go for a code of 6. Now, another reason we code when the we have a wrong dose. So do familiarize yourself with the common medication you have in implementation station and the correct dose. If paracetamol, for example, is prescribed for a patient that is weighing less than 50 kilogram and you have a prescription of 1 gram, that is a wrong prescription, incorrect prescription. You can always go for a code of 6. So I'll put a code of 6 for that and no sign beside it. When you have allergen products or derivatives prescribed when a patient is allergic to such product, you would definitely need to code that. You don't want to end up with code 9 when your patients, will develop anaphylaxis. You don't want to wait for that. So if, for example, a patient is allergic to penicillin and you have augmentin, ampicillin, flucloxacillin, and all the other derivatives prescribed for your patient, no, 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 no. You have to escalate that. That's a wrong prescription. I will give it a code of 10. Now, we have just a sample scenario of a chart with a patient who is allergic to penicillin. So when you're reading your match chart, just put that in mind. When your patient has any history of allergy, just carry it along in your mind as you're reading your chart. You must not make that error. Okay? Now, when you have incomplete interval between when the patient took the last medication, for example, paracetamol was given at 12th hour, I'm serving my medication at 14th hour, that is incomplete timing. I have at least minimum of 4 hours or maximum of 6 hours interval should be between the last time a patient had paracetamol before another dose can be repeated. And sometimes it may be other components of medication that contains paracetamol. For example, cocodamol, 8 over 500 milligram given at 12 hour, and the patient is due for paracetamol at 14th hour. If the paracetamol is under PRN, I don't need to code it, but I will just verbalize and escalate that it's not due and it's not safe to give, but I'm going to follow up and make sure another safe analgesic is prescribed that does not contain paracetamol. But if it is at my under the regular time that I'm supposed to give that medication, then I will definitely need to code it. I can give it a code of 5 if the paracetamol is given under start dose or cocodamol. But if the cocodamol or paracetamol is given under regular medication or under as required medication, I can go for a code of 10 and state the reason. Patient had it less than 2 hours or patient had it less than 4 hours and is not safe to give. Now, for inappropriate clinical parameters, the heart rate is less than 60 and I need to give digoxin, I need to code that. That's a code of 9, low pulse, low heart rate. Antihypertensive, blood pressure is less than 110 millimeter of mercury systolic, I'm going to code that a code of 9. Okay. Now, when we have anticoagulants prescribed for cases of bleeding, subdural bleeding, active bleeding, immediate postoperative cases, and I have warfarin 2 milligram to be prescribed. No, 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 no. I will know that is going to increase the risk of bleeding in my patient. I don't want my patient to end up with bleeding and have a code, emergency code because of that. So I'm going to code that. That is an incorrect prescription. So I'm going to give that a code of 10 and state the reason, risk for bleeding. Patient is on milk by mouth, we have a code of 8. That is not likely during your implementation, but it may precede the timing of you serving your medication. A code of 7, that may happen. Patient refuse medication. Maybe they tell you under regular, they say they are not in pain. Not likely, but just in case, for any reason why your patient refused the medication, that will be a code of 7. So for any drug you've coded, please don't forget, go to the last page of that medication chart. Now, let's have a look at that. Okay, so the last page of the medication chart, you write the date, the drug, you write the dose, the route per oral, the instruction. The instruction is just the indication or the action of that medication that your patient is allergic to or that you are omitting for whatever reason. So for this sample, it's the indication is for chest infection. The time that prescription was due. The prescription was due to be given at 8 hour, but in brackets just put not given. Then the reason for omission or delay, the reason why I choose not to give that medication. For this sample, it says patient is not on the ward. You can just put the code in circle, a code of 2. Patient is off ward. And if it is for other reasons, probably the patient is allergic to penicillin, I'll just put a code of 10, allergic. And the reason will be allergy to penicillin, a code of 10, put it in circle and sign my signature. Of course, the pharmacy check is there, and that will be all. And then under the regular charts where the medication is prescribed, make sure you do sign it, put the code, circle it, sign, and put the time in as well. And that will be all. I hope this gives more light and understanding as regards when you need to code, how you need to code in your implementation station. All the best and bye for now.